Good afternoon, everyone. Sorry about the little bit of delay in the start, but thanks for joining us today. We're going to do a little bit of Q&A. Again, please type in questions through the Q&A section. If we can open it up for other questions, I'll talk to our tech team and see if we can open it up a little bit later but use the Q&A right now for questions as we move forward. We'll go through this real quick, just to talk about the grants. You probably already seen the website where you can get more information from our landing page and the application. But real quick here, just kind of going through, there we go. So you've probably seen some other projects more recently through the pandemic that the Medical Society has teamed up. This was our Mask Up New Hampshire project with the Hospital Association. Next slide. We also did through most of 2021 our Vaccine Alliance, where we had up to 500 participants and did updates on the whole implementation of the COVID vaccines early on. Also wanted to bring to your attention another project we're working on with 4 hospitals in Coos County, calling the Northern New Hampshire Mobile Clinic project. This is to bring a high-end Mercedes Sprinter van to there. We've already raised over $1 million, so the van is paid for, and we're hoping on delivery for that van to be mid-year this year. All right, a little bit about the grants real quickly. This was approved by the Executive Council and the Joint Finance Committee in December of last year. It is being facilitated through the Medical Society under the aegis of the Bureau of Infectious Disease Control, and is using CDC funds that are mandated through the American Rescue Plan. What is it? It's $2 million in grant funds to increase infrastructure and capacity to administer and reduce barriers to COVID. And here's a dirty, rotten secret, other vaccines that you might be giving out. This is intended for what we'll call independent healthcare practices, clinics, and medical offices. If you're part of a community health center, FQHC, or a hospital, there are other funds that are being contracted through the state, through the New Hampshire Hospital Association, Bi-State Primary Care Association. Next slide, please. Okay, when does this start? We will start reviewing applications as early as this week, February 11th, and we'll keep that open through April 1st for our first round. And each facility can submit one application. It can be multiple elements, but one application per facility practice clinic. So if you're a multi-site practice, just one application from that practice. If there are funds available, then we'll open it up to a second round where everybody will have access to it again between April and June. These grants include one or more of the following expense categories. They're to be incurred on or before October 1st. But we have one question in there already about equipment purchased for use, and we'll talk a little bit about that in a minute. But it's really for your clinical support. So anything after October 1st, administrative support. And these are all for the provision of COVID-19 vaccines, but it can include technical IT assistance. So say another category, you're going to buy some computer software, you're going to upgrade your EHR, and you need some technical IT assistance to go with that. That could be part of this particular grant. Also supplies and equipment such as freezers, refrigerators, data loggers. The reporting requirement, here's the string, is that you have to report a series of items, and they're listed on the second page of our landing page. They're not extensive. Most of them are text, a few items, but fairly simple, and only quarterly reporting and only for 1 year. So our landing page and application is there at https nhmedicalsociety.com/grant-application, and you can go there. So that's what we have as far as the present, and we're happy to entertain any questions you have. The first one that I see is from Dr. Arsenault, is we submitted purchases related to a vaccine prior to October 21. We bought a new vaccine refrigerator in July 2021. Technically it's outside, but I think it's something that we can entertain, at least to, and what I would do is I would apply for it. If you're still paying for it, or if you haven't used it, that can go into the rationale. But it's something that we can at least take back to the Department of Health and Human Services and ask if that would be a permissible expense for this. So it's not out of the realm. We'll probably have a number of folks that will kind of fall into that category. I'm happy to answer any other questions you might have about this. Again, one application from now until April 1st. Applications you'll find are fairly simplistic, where we ask some basic information. We ask you to list either the staff that you are essentially asking for reimbursement for, and we also have a sheet where you can list various items, and then either append either invoices or receipts, or what would be essentially personnel logs to say that these folks were working in your service during the time for COVID, the administration of COVID-19 vaccines at that time. Again, fairly straightforward. We have $2 million. We are trying to get to you as quickly as possible. We're trying to make it as easy as possible for this to happen. And we're happy to address any other questions you might have. Just type them in. If you'd like to speak, I think we can open this up. I'm not sure if we can or not, Brian, but just you could raise your hand. And
if you want everybody to be able to just talk anytime they want, I can set that up. The other option is promoting everyone to panelists, and they can share their screen, video, and audio. So whatever you wish.
Why don't we just open it up to anyone who'd like to talk audio at this point. So if you want to just either raise your hand or if you just like to talk about this, please unmute yourself. We're happy to entertain any questions that you might have further about this right now. But $2 million, and we're trying to get rid of it as quickly as we can.
Everyone should be all set. They should be able to talk now.
Okay.
And a question just came in as well.
Okay. Question, can you talk about the requirements for staff support, new hires, how many hours I can allot to them? I think this is mostly from, again, October 1st. I think the staffing requirement is really more fixed around October 1st, but anytime from October 1st that you dedicated administrative or clinical staff for the provision of COVID vaccines is all they're really looking for. So if you can show us, just name them. I think we have actually on the sheet a couple examples. We're really just looking for certain things, basically their pay rate and the number of hours. And then we're just looking for the total hours that you are requesting from October 1st to essentially now, and what that figure is, and just giving us enough information that we can justify that expense to DHHS and CDC. So pretty straightforward. We're trying to make this really as easy as possible without as many strings as we can here. Other questions? Just unmute yourself.
Malcolm Perry has their hand raised. I just asked them if they can unmute.
Thank you. Malcolm? There you go, you're unmuted.
Hi. Yeah, hi. Sorry, technology. I just had a quick question, just to follow up on the last question regarding staff support. This is not only direct staff, because there are many people that have time associated with vaccine administration and scheduling.
Mm-hmm.
We saw a tremendous call volume during that time. So our total call volume went up around 20%, and it was all related to people trying to schedule COVID vaccine appointments. So it is not just direct what I would call direct staff support. It's also indirect. Is that
yes,
true?
Yes, so schedulers, any kind of administrative staff support related and just to the provision of essentially arranging those vaccines. So it could be clinical and administrative. And even, if you had to do some upgrades on an IT basis, you could include those. So indirect support, support services, administrative, however you want to frame that, can all be included.
And marketing and website updates and things like that as well?
Mm-hmm.
Okay. Thank you.
You're welcome. Yeah, just make sure when you do this to include, names, information requested on the spreadsheet and total hours, and just be able to back that up in some way. And that's about it. Other questions? Okay, well, I hope this has been somewhat helpful. If you would like, please contact me. We'll leave up on the screen when we leave. We'll leave my direct contact information. Please give me an email or a call, and we'll help walk this through you. Again, it's our firm desire to help make sure that we push this money out to you. So thank you.